My name is Dusty Cole, and welcome to the Business Builders Podcast, where we interview salespeople, entrepreneurs, and business owners and learn how they overcame challenges to build a successful business. So welcome back to episode 8 of the Business Builders Podcast. My name is Dusty Cole, and it's my honor to welcome Dr. Lisa Miller with Lisa Miller Oral Facial Surgery in Foley. Did I get that right?
You got it right.
Very
Great
nice.
job.
Thanks for joining me
Of
today.
course.
So I thought we would start maybe just with a little bit of how you got into the profession, what interest you had that led you to doing all that amazing schooling that you did.
Very good. Well, I actually went to dental school. I'm from Pennsylvania.
Okay.
Went to college, got a degree in music. At that point, I knew I was not going to be able to support a family with my musical talents.
Mm-hmm.
And my dad was very enthusiastic in the fact that I had to be off the payroll. So I had to figure out something else to do.
Mm-hmm.
I had a friend of mine in dental school or in college that was looking at going to dental school. So I went with him on his interview. And when he went to Temple University, which is where I went to dental school, there was something about it. I just kind of fell in love with it. They had a great admissions counselor that just made you feel like you were how you would help people and how you can change people's lives by a career in dentistry. And I was just totally hooked. So after that, I went and I shadowed some dentists. Of course, since I was getting a music degree, I had to do some prerequisites because they were less than impressed with my musical abilities to pursue that. So I had a year off between college and dental school, and I went and worked for a dentist, and that kind of solidified, knew I wanted to do that. So I applied to dental school and got into school. I went to Temple University. Mm-hmm. And when I was there, I never actually thought about specializing. You know, there's different specialties that we can do in dentistry. Mm-hmm. The school I went to was very clinical based. And so they were really, their purpose and their was to create and train excellent dentists and practitioners, not necessarily get dentists to go into specialties.
Okay.
Which was good. Yeah. And so I just never had it on my radar. But I had a oral surgery instructor. She happened to be the first female dual degree oral surgeon in the country. Now, because with oral surgery, some of us have our dual degree, meaning we have our DMD, our dental degree, and also our medical degree. So part of our schooling involved going to medical school. Okay. So she was the first female to do that. And oral surgery is a very male-dominated specialty. She kind of took me under her wing and encouraged me to do that. Mm-hmm. At the time, I was like, well, that sounds like I enjoyed it. So we got to spend a lot of time in the clinic, got to take out a lot of teeth. I thought it was great. And with her encouragement, I had a few other attendings that were there that were so encouraging that convinced me to do that. So then I applied to oral surgery training and ended up in Alabama.
So is it still a very male-dominated field? Or
yes. I think statistically it's about 10 to 13% are female.
Okay. Why is that, you think?
I think because of the length of the training. I mean, we go, like our training was, so after dental school, mine was another 6 years. Wow. So that's a long time and a long commitment.
A total of 10? Forgive my ignorance.
It was a total of 10. Okay. So, I mean, I didn't finish residency till I was 33.
So like people become moms and things and that.
So it's hard because if you want to become a mom and our training is a little, it's very demanding. I think all specialist training are, but it's more similar to the medical realm because we spend a lot of time in the hospital where a lot of the other dental specialties, maybe you get a little bit more time. It's not quite as demanding. My first year of training or my first year of residency, we'd work 120 hours a week easy. Wow. You know, you'd be at the hospital all the time. You come home to sleep a little bit and then
like a doctor.
Yeah. So we do, our training is basically where we are, we're employed under the ACGME, which is all the medical residents, we're grouped in with them. So we're considered medical residents when we're in the hospital.
I see. Very interesting. So you started your practice in Birmingham, right?
I did. Yes.
Okay. And what was that like? So just you went to work for someone else, I think?
I did. So what I did is I finished in 2009. And I worked, at the time, my husband had already finished his residency. He's a family physician. And so he had a job working for the county hospital because he had a commitment for a scholarship to meet. Mm-hmm. So I had to find a job in Birmingham or somewhere close in that vicinity to stay. Okay. Also, I just had my daughter, when I was finishing, she was a year old. My parents just relocated to Birmingham. Okay. So I didn't really want to move too far away since they had just relocated here to be by us. Right. So I was fortunate to get a job with a multi-doctor practice in Birmingham, and I worked with them for about 6 years.
I see. So you didn't own your own practice there. So you opened your own practice when you moved here?
No, I worked with that
Okay.
group for 6 years, and
Okay.
then in 2015, I made the decision to go out on my own and start
Okay.
my own
I thought
practice.
so. I did read the Bible.
Yes, yes. So
All
I
right.
was, and then I had that practice there for 6 years before we decided to come down here.
Okay, so when you open your own practice, this is things I'm interested in. So like, what do you start with in regards to like employees? Is it like you start really small and then grow from a staffing standpoint?
That's what I did.
I mean,
I was fortunate because I was coming from an area, and I'd worked, like I said, 6 years for somebody else. So I knew some people. So whenever I started my own practice,
okay,
there were people that had worked through the office that were no longer currently employed by
right,
that oral surgery group that I was able to reach out to, that had certain skills that I thought could be helpful.
okay,
So I hired somebody to work kind of up front. And then I had to hire two assistants. Basically, when we're going to sedate patients in the office, we at least have to have 2 people working with us. So like 2 people in the operatory just for safety purposes.
right.
So initially started out with 3 employees.
I see. So that was another one of my questions. So when I came in your office, I could see, it seemed like you had admin staff behind the counter and then a different level of experience in the back. Is that right?
That's correct. Yes.
And what does that look like? How many different positions do you have?
So right now I have an office manager
Mm-hmm.
who has been amazing. This is actually the first time in the whole time I've had my own practice that I've had somebody that had the skills that's truly an office manager. She has a degree in healthcare management. She's been amazing. So she's helped me tremendously. But so I have my office manager. I have 3 girls that work up in the front, and they're more of the administrative type
Scheduling and
employees.
things.
Scheduling,
Yeah.
they handle insurance, benefits, claims, things like that.
Okay.
And that they all work really closely with Jennifer, my office manager. Now in the back, I have 4 surgical assistants, which is nice. I like to have anywhere. Sometimes with staffing being difficult, it can be challenging at times. You get down to 3, but I really like 4 to 5
Okay.
because I'd rather have more people and we can provide better service for our patients. I never want them to feel like they're getting rushed out of here
Right.
just so we can do more surgery in a day. So I'd rather have more people so we can kind of spread things out and take our time.
But that's interesting to me also. I find it interesting because you have to make money, right? So, and you don't make money unless patients come through there in a very organized manner. But then again, you don't make, just like you just said. So how do you balance that between you got to get them through efficiently and not making them wait too long and not making them feel like you just described?
Well, I think they want to feel like they're important. So I think spending some time just getting to know them and talking with
Right.
them on a personal level. And that's where I try to do that. But also my assistants do a very good job because they end up spending more time with all the patients than I actually do, especially because with what I do, I'm sedating a lot of my patients. So I get a chance to talk to them.
Yeah.
Then once they're asleep, I'm in there the whole time, but they don't remember that.
Right.
But they're able to connect with patients on that personal level. And that, I think it makes it makes a scary situation more comfortable for them.
Got it. How did you know you needed an office manager?
Well, I guess, and it's what
yeah.
I should say correctly is I had employees that worked in a role as like the office manager.
Oh,
Their training was more kind of on the job type training, not
Right.
somebody that had the educational background along with the experience.
I see.
And so that's like kind of was a big jump that after I got down here and was able to get established, that I was able to make. And it has been extremely rewarding because what that's done for me is I'm somebody who's been very hands-on the whole time.
Yep.
I always paid my own bills. I did payroll by myself. I did all of that. And so that was good because it taught me a lot because I learned things. I
what
learned how
they're
to
gonna
do things
Yeah.
and I didn't, but I also, it's hard to do everything.
It is.
And there's only
to wear all the
24
hats.
hours in a day. And so
Right.
it was nice to have somebody that was able to relinquish some of those responsibilities that were probably not something that I had to perform.
So what were you able to do better or with more energy in your business now that you had someone qualified like that?
With a couple things I think it's really helped us with. One, I think just with employees and those kind of relations, because it's easier for me if I'm not the one that they're always coming to with good and or bad.
Got a minute?
It's been able to separate that out a little bit because it can be challenging whenever you always have either problems you're trying to solve
Right.
or things like that. Plus, I think the 2 of us could kind of work together to help manage if there's any kind of employee issues,
Sounds like
concerns.
a sales manager in my world, to kind of to manage this day-to-day sales aspects. Man, I know what office manager is also,
And
but yeah,
it is kind of a buffer for me too.
right,
I like to know what's going on, but I don't have to know everything in real time what's going on.
right,
I feel that that's helped me. Like it is because I don't like to get hung up on things. Say during the day when things are going on, if
right.
there's other issues, that's something she's been able to take care of that, so I
Yep.
could focus on patient care
Mhm.
because that's where my attention has to be
Right.
during the day.
And Heather does that for us really well. My wife, who
Mhm.
works with me, and she handles a lot of the day-to-day stuff with the agents and the staff. And then, of course, we come together later, and I get filled in. That helps me be in my highest and best use during the day, which is client focused. So I can relate to that. What initiated in my mind that I wanted to interview you was we were sitting in there, and you were telling me about your move down here. I don't remember it exactly, but you said something about COVID, and it kind of changed your plans. And I was like, she adapted really well to that. So I'm not sure if you remember that story, but maybe
I
revisit that. Yeah.
So basically, but when COVID hit in 2020,
Mhm.
I had a lease on my building that was going to be up May of 2022. So I'd already prior to COVID hitting had contacted just a commercial real estate agent in Birmingham
Mhm.
because I knew I wanted to move. My building was a little dated. It was in a prime location, but rent was very high and expensive, and it was definitely not going to go down.
Yeah.
So I was like, well, and I don't necessarily need the space. I was on the second floor of a building, so it always has obstacles because you have an elevator when you're wheeling people out.
Yep.
So I was like, yeah, and if I could buy something that I could own, that'd make more sense from
100%.
just a business standpoint. So we're in a process of looking. When COVID hit and it basically shut us down, we had a condo down here in Orange Beach, and so my family and we just came down here. My husband could work remotely. There wasn't a lot going on in the office. I had my employees in the office work. I was fortunate that I had reserves saved up, so I was able to pay them while we were closed during COVID, but they were able to come in, answer the phones, and just keep me abreast of what's going on up here. But at that time, I decided that I would have the people that were looking up there. I was like, just for kicks, why don't you just look down here and see what's going?
The real estate agents?
The
Okay.
real estate
Okay.
agents. I said, or a commercial group from Birmingham. I
Mhm.
said, why don't you just look down here and see what you can find?
Mhm.
My husband always knew we wanted to retire down here. We would spend a lot of time here. This was always my happy place. And so we decided that we would look. They were giving me options. Then also the other kind of confounding factor was schooling for our kids. While COVID was happening up in Birmingham, when kids went to Vestavia, they were much more strict, and they were decided for the fall,
Mhm.
they were going to stagger their school schedule.
Mhm.
Well, at the time, I had a daughter who was going into 7th grade and my son was going into 3rd grade. So they were going to be on staggered schedules. So it's really hard to figure out how you can work whenever you have your
Right.
kids are going to have to be at home.
Right.
And at least basically for us, it would be every day one of the kids would be home. And the last factor that happened is that my husband works for an insurance company, and he was doing home visits for Medicare patients. He was a great model that they had, but they decided that they were going to eliminate the physicians and just keep the nurse practitioners on. So we knew he was going to be looking for a new job also. We couldn't really figure out, it was hard for him to figure out how to get a new job whenever when the kids were going to be at home.
Right.
So we figured out when Baldwin County decided that they were going to go back to school, we're like,
Mhm.
we want our kids in school. We
Wow.
felt very strongly that we wanted our kids back in school. So we're like, well, that's the thing. And then God always plays a part in everything. We put
Sure.
our house on the market and it sold within 24 hours.
Okay.
My daughter always likes to remind me it was on her birthday. She said it was the worst day ever, but we were thrilled that we got.
She was
we
mad.
got a couple offers on her birthday. Oh, she was not thrilled at
Yeah.
first. She loves it now, but it was a little adjustment, especially when you're starting middle school. But
right. All the friends and things.
so that kind of pointed into the direction. We're like, well, we got to do that. We happened to then look quickly and found a house, and
Okay.
we moved.
So the building you're in now, though, when did you start your practice?
So I started my practice. We opened August 2nd of 2021.
Okay.
So this is in 2020. So I still had my practice in Birmingham. So my family moved and the kids started school in August of 2020.
Okay.
We moved into we closed on our house 3 weeks before Sally, and then Sally hit. So we were in the process of renovations and everything. It was fortunate for us because Sally hit. We had damage from the storm, but we already had contractors, so it was fortunate because we were able to get some stuff done. Now we had to get a new roof and different things we weren't planning on,
Right.
but that's okay.
So we're already in motion.
You roll with the punches, right?
Roll with it. COVID, that was the year of.
That's right. So many things. And then we decided on the building that I purchased, and we ended up buying and closing on that at the end of November of 2020.
Okay.
That's right. And then, so I had plans already set up because it is easier the second time around when you're going to set up a practice.
Because you've done it before.
You've done it before. Yeah. And like you learn, I made so many mistakes the first time around. I made mistakes the second time around, but they weren't quite as costly as the ones I did the first time around.
So let's talk about the mistakes you made and how you learned from them and what you're wanting to share. So what are some of the mistakes you made in Birmingham that you corrected when you came down here and did it again?
So when I was setting up my practice in Birmingham, I hired a group that was they set up oral surgery practices.
Okay, interesting.
They do it for a lot of like new doctors coming out of residency and things like that.
Okay.
They were very helpful because they can make a lot of decisions. They kind of have a lot of stuff. They have deals with a lot of the companies we can purchase equipment from, so maybe for pricing and all of that.
Okay.
So that was good. And it helped me because at the time when I was trying to set up my practice, I had a really good relationship with the doctors at the office I was leaving. They knew I was leaving.
Okay.
I had to give a 90-day out on my contract and they still let me work there. So I was still working and I needed to still work. And so I had this other group that was helping me set up my practice.
Okay.
Another thing that was actually really nice is that the office I used to work for, they were in the space where I set up my office. They had actually moved out and bought a building. And then that space was for lease. So I didn't have to do big, whatever, improvements.
Okay.
But probably the biggest downside was I used this outside group because I realized quickly that over time, things would kind of show up. And I was like, well, I don't need this. I don't want this. They're like, well, all oral surgeons want this. I was like, well, I don't want it. I didn't use it before. Why do I not need that now? So it was kind of somebody who never practiced it, kind of telling you what it is you would need.
And you didn't understand why you didn't need it?
Basically it was because they felt that this is what other people did, but I'd already, I'm a very routine person and I'd already worked for a while. So I kind of knew what it was I wanted.
Okay.
If that makes sense. I took pictures of all the equipment that was in the space because it was in the same space I was before. And I said, I want the same stuff. Well, it turns out I did not get all the same stuff. So one of our biggest issues is when we went to get ready to start working and be operable, my vacuum pump was not appropriate for my space in that there was something with triple phase and single phase and with the electrical was not right. And so the pumps that they purchased, the other practice did was single phase because they'd order things that they were using. Well, the people who were buying, who was buying all the equipment for me reached out to the realtor, not my contractor, who was familiar with the space and bought wrong equipment.
Hopefully they made that right.
They eventually made it right. Yes. It was a big deal. Like they signed a lease with a company for internet, which did not have access to the building, even though they thought that they did. So when we go to start up, I had to use dial-up internet.
So when you moved down here, you didn't hire that company.
I did not hire that company. I had a dental supply company help me do my layout for my space.
Okay.
But a lot of the stuff I knew what I needed because I knew what I had already.
Right.
I was able to deal with vendors on my own, and then I was able to purchase things. And the other advantage that I had is since I was still working in Birmingham, I didn't have to loan as much money because I was able to make purchases slowly along the way. So I could pay cash for more stuff and limit the amount of debt that I had to get into to get started on this practice.
So when you moved down here, like how do you, obviously I was a referral to your office. Is that how you get most of your business, referrals from general practitioners?
Most of it's a referral business. And so usually it's coming from general dentists. We have some endodontists, some like the dental specialties, orthodontists, and then also referrals from patients who they will come in and they'll say, hey, this is, my friend saw you, they said they should come see you. So that's how we generate most of our bits. So a lot of our marketing is geared towards our referrals.
Like business to business. Because when I came in there, I didn't really know you were there, but you seemed really busy. So I was like, wow, it seems like she ramped up really quickly. What do you think led to getting going pretty quickly? Or am I characterizing that properly?
Yes. And I think, one is that in Baldwin County, we definitely have a shortage of medical professionals. Like there was a need. Like it was not a hard decision to say, hey, I'm going to leave Birmingham and move down here. I mean, where I was in Birmingham, I had 10 oral surgeons in a 5-mile radius of my office.
Okay.
Like there was two very well-established, very good doctors just across the
it's
street.
Like market share.
Yes. So it was, like I said, there was so many. When you come down here, there's only like 4 or 5 in Baldwin County. So marketing is different. Marketing was different. Like I had to go out and get to meet people, but people automatically came because once they figured out they were like, they were just so thankful that there's somebody else could see them because it could be a month, 2, 3 month wait out or a long drive.
So demand higher than the, so did you analyze that before you came down though? Were you aware of
I did.
that?
I had a company that pulled numbers. So I knew that was the case in this situation. Because Alabama, with our specialty, oral surgeons are basically concentrated in the big cities. You have Huntsville, Birmingham, Montgomery. Then there's not as many still in Mobile, but we knew, but I also knew statistically the growth pattern of Baldwin County.
Right. Yeah. So when you hear of another surgeon coming to town, is it like that's my competition, or is it like there's still enough for everybody to?
Oh, there's still enough for
abundant
everybody.
Mindset.
That doesn't. I think it's good for patients to have choices.
Right.
I'm not going to always be the right doctor for everybody, and I think it's important that there are choices for people to have.
Right.
I think if you provide a good service, and I think if you treat people well, you'll be okay.
Absolutely. We have an abundant mindset also.
You mentioned a lot that you had like people, like a company that set it up for you, like to buy the equipment. Then you said that you had a group to like get the numbers. Where did you learn that? Like, how did you know that there's someone who can pull the numbers? Like, where did you learn?
It was like a consultant.
Question. So a lot of it is that I had just other oral surgeons. So I knew people who had set up practices. And so like the group that I used initially in Birmingham, there was colleagues of mine who had used them. So that's how I knew like who to reach out to. So a lot of it's through colleagues. Some of it's through just searching on the internet and finding out, because you get a lot of information. Our national organization, AMOS, which is American Association of Oral and Maxillofacial Surgeons, and also the ADA, the American Dental Association, they have resources to those things too. A lot of it on number of dentists, and then the demographics of communities and things like that. So I pulled reports from there too.
So that was going to be my next question. There's always like proprietor groups. You just described a couple. Do you have to do you have to be a member of those, or you're automatically?
You usually get a membership to those groups. Which you have to pay for every year. And they do different things. They have meetings every year, so it's like educational aspects. Most oral surgeons are members of AMOS.
Do they lobby? And
they do,
like,
of course. And there's the they have like their political sides that you can do, which is it is important because there's certain issues that that's definitely important that are brought before our representatives and our congressmen and things. So you need somebody that's going to, because there's different things that happen politically that can affect your ability to work and do things. So that's important.
We learned that in COVID, right?
Yes. But there also the other thing where it was different, and I grew up whenever the internet and none of that stuff was new. Facebook came out when I was in dental school. So it was kind of cool because that's how you got to connect. But there are I'm on a bunch of different Facebook groups for different. There's a mommy dentist in business, which is great because it has a different perspective. We have a women in oral surgery Facebook group.
Cool.
So a lot of those people are great references too, because you have a question you can ask, and chances are somebody at least has done it. So I guess some of it's realizing there's no reason to have to reinvent the wheel all the time.
Absolutely.
Because there's usually people
duplicate.
that have been there and can help you with it.
So what do you think your biggest challenge was being in a new area? Was it staffing? Was it getting the customers?
I think my biggest challenge was probably employees and staffing.
Yeah.
It is hard, especially post-COVID. Staffing has been a challenge. When I was in Birmingham, just because I'd been there so long, since I was 6 years a resident, I was there. I practiced another 12 years there. I knew a lot of people. So I knew a lot of the referring doctors, but also know a lot of people that worked in dentistry. So if I need an employee, a lot of times I had a base of somewhere where I could go. Where here I did not. I did not know anybody. The first person that I hired to work down here was somebody who was going to drive from Florida, and she decided before she even started working that she didn't want to do it. So I was like, oh,
0 for
this
1.
is going to be, we were 0 for 1. We're 0 for many.
Yeah. It's normal though. Huh?
And it's It is. And also
Yeah.
because they don't know your personality and you don't know theirs, you don't have any. So I did it. And like I said, I didn't have the same resources that I was used to for what I had in Birmingham. So that was a huge challenge.
So how did you get momentum with it? Because when I was in there, you seemed very well staffed and very well trained.
So I was fortunate because I think even when you were in, what I did is I was in between both offices for about 18 months.
Oh,
I
wow.
was traveling back and forth
Okay.
between Birmingham, where I'd work in, I don't work currently in my office. I always take administrative day. I started doing that when I first opened my practice because I was super important. I needed like time to get stuff done. So my administrative day for Foley was always on Mondays. I did that because then I could spend an extra day and not have to go back to Birmingham until Monday because I would see patients in the office Wednesday through Friday. So I did that. Whenever I was getting ready and things were slowing down, there were girls from that office that would travel down with me.
Oh, wow.
So we were able to make arrangements so I could help them with their housing and things like that. And they would come down, especially for my surgery days, because that's whenever I needed more of the help.
I see.
And I had one great employee who I've worked with her since I was a resident. I've known her for 15 years. She's been doing oral surgery work for 30 years. So having that
Your
was
right hand.
nice. She's kind of like, she was my right hand. And, but so she traveled with me for a while. She actually just stopped working within the past year. Her mom got ill and she needed to be home and she needed to be with her family because it is not easy to travel back and forth. That was probably the most challenging 18 months, just missing everything that's going on the day-to-day basis for your family.
Yep.
I was very thankful that employees that would come and travel and do that because it is a huge sacrifice, but it's not something you can do permanently because it's just too hard.
Yeah, it's hard.
But they did help me find then other people here, get them trained.
I see. Training is going to be, and another thing. So if you're not like full time down here, it seems like that'd be hard to retain people that aren't getting full amount of hours.
Well, they would get full hours.
Between
One
the
thing I've learned, they would get like the people that I hired here, even if I wasn't here, and even I do this now. If I'm not in the office, as long as they're doing things, I don't make them
I see. So they're
be out of the office.
Okay.
Because don't feel like their schedule should be affected by what I'm working.
Right.
My biggest request like I have from them is I like them. If I'm going to be in the office, I mean, they could take vacation time to be off when I'm there. But if I'm out, like it's nice and preferable if we can line up our trips, like, but I don't require them to do that. But I always, like when I hired people for full-time jobs and with benefits and things like that, like even if I was in Birmingham all week, like they would be here and they would help get things together.
So the office doesn't stop just because you're gone.
They had a lot of downtime. I think it got a little boring for them for a little while, but they kind of hung in there so we could.
Right. Sometimes they're probably okay with boring.
Sometimes.
In our business, culture is super, super important. It's kind of like, what are your employees saying about you? Or like, what are your employees saying about what it's like to work there when you're not looking? That's your true culture. So what have you done to build a culture where people want to be a part of it?
That's a great question because I think to me, I always tell my employees, I want them to feel whether this is the job that they work at short term and then they find something else that's more what they like, or they're there for the long term. I want them to feel that it's been beneficial for them. Right. I don't want them, it is a job, and I stress them, it's not always going to be fun. That's why work's not always fun. But I said doing a good job is what really makes it fun and getting that end result for people. But I think it's working on developing them in that regard. Like I like to, every once in a while, get them books. Because I do feel that with just little, there's a few books that I did have a practice consultant that recommended a book called Who Will Do What by When. Who Will Do What?
I've heard of that.
Great book. And it's kind of a dumbed down thing, but it really talks about the team aspect. And there's so many points from the book that I still remember. And I try to use like whenever I'm interacting with my employees, but I try to stress that to them. So we'll do that and read a book. Another great book that I love is called Make Your Bed.
Okay.
Great book. And it's a super quick read. It was by an admiral in the Navy. He was based on a graduation speech he did at the University of Texas. But his basic premise, he has all these little small vignettes in the book, but his basic premise was like, you want to make your bed every day. If you make your bed, you at least have accomplished something. You've accomplished a task.
Start with a win.
So that book's great. So I will give that to them. One I just gave to them like a week or two ago is a book called The Coffee Bean, which I heard on a podcast. I heard the man Damon West, who wrote the book, was on a podcast I was listening to. Incredible story. But the book, again, it took me 20 minutes to read, but it's basically the premise of it's based talking about how you can change the world. Like what you do, you don't want the world to change you, but you want to be an influence that can change the world. But anyway, so I like doing that because I want them to know that I'm trying to invest in them more than them just showing up for work each day.
Kind of like leave them better than you found them. If they go work for someone else, they have more skills than when they started with you. That sort of thing. Yep.
And I also, we do things like we'll go to meetings to try to help increase their improve their education and
like events and
things like that. Yeah, like it's our annual. Our national organization has an annual meeting. We didn't go this past year. The year before it was in New Orleans. We went this upcoming year. It's in Orlando.
And do you make it fun with them a little bit?
We'll take them. Yeah. So they'll go to the meetings during the day, but we'll go out to dinner. We'll do fun things because that's important. We also like to do a lot of team building where we just spend time outside of the office. We've done different events. Our Christmas party, we went to a hockey game, the Ice Flyers game. We had dinner and did that. But it's nice to meet their families and get to know who they are outside of them. And I don't want them to always just think that I'm the doctor and they have to be afraid of me, that we can, there has to be the, employee-employer relationship there and know that exists. But they also, I want them to know more about me and I know more about them and what makes them tick and what's important to them, because then I can help direct things better that way when I know where their kind of motivations are.
Yeah, that's good. I can see that too. We have some that have worked with us for a long time, and then those lines sometimes get a little blurred because you care about them so much, when they're on the team for so long, and it's kind of hard to keep that separate sometimes. But that was good. Thank you for sharing that. So I'm always kind of fascinated with the scheduling of doctors' offices, or even, and we kind of touched on it a little bit, but like just maybe from a technical standpoint, how do you schedule it so it's efficient? Have we already asked that? Let's just try. Okay.
So for scheduling, I tried to, and so a change I made from when I was in Birmingham. So I was in Birmingham, it was more, the doctors, all the oral surgeons for the most part, did their consults and the procedures the same day. There was a big demand to be seen right away, get it done, and do it that day.
Okay.
When I moved here, since my schedule was less predictable, and it's because I was traveling, I decided that I really wanted to consult the patients first so I knew what was going on. Plus, it is a little bit surprising, but you see a lot of people that have a lot more health issues. I see a lot of patients that are older. 'Cause, right now we're in snowbird season. And so people do have things that you want to make sure that you can address or make sure you have all the appropriate information on so you can treat them safely. So I think one thing that we've done is that since I know what I'm doing, like what procedure I'm doing versus having on my schedule, hey, you're going to take out this tooth, and then they show up and there's all this other stuff going on, because that is really an easy way to put you behind. So kind of knowing everything you're doing ahead of time, it allows me to say, this is what our plan is, this is how much time I need, and so we can schedule it appropriately.
So some doctors don't do it that way? They tried.
No, I think here more people will consult. And I think they do because it is much easier on your schedule. There are times like if somebody's young and healthy, needs to get their wisdom teeth out, if I can review the film ahead of time, we'll just have them come in that day. And then we block a little extra time because we know we have more time that's needed to talk and things like that. But I think it's allowed us to keep to do a better job with scheduling and to be able to respect people's time better, knowing what's going on ahead of time.
What is some key principles in which you try to keep top of mind when you're trying to provide good customer service?
I think that whenever I first started my practice, I wanted it to be different, and I wanted to be different based on customer service. Like nobody likes to see the oral surgeon. Like they just don't. Let's face it, like they don't. And I try to stress that with the girls on my team that be like, most of the time, because even if people are not really nice and excited about it, they're not excited to be here, and they're nervous and they're scared.
Yeah, some people are scared. Yeah.
So a lot of times I think bringing in and making it about the patient. I always love talking to patients, finding out what's going on, where they go to school, like whatever.
Just getting to know them.
Anything. I love to just because it makes it then about them, and I don't have to focus on what it is that we're doing. But also from a customer service standpoint, we like to be prepared. So we do like patients fill out their paperwork. It's not because we're trying to be difficult. It's really because we look at it ahead of time because we're trying to be prepared for their appointments. So we can get them in and be efficient in that manner.
Yes.
I call my patients after surgery. I do that because one, I really like to know that they're doing okay.
Mhm.
First of all, it's a lot easier to rest at night knowing that. And number two, if someone's having an issue, I'd much rather know about it before I go home.
So you personally call 'em?
I personally call
Yeah.
them. It takes like 10, 15, maybe 20 minutes at the end of my day to do that. But then usually whenever I've done that, I know that I can basically, everybody's tucked into bed and
Right.
it's okay.
Yep.
Most things would then be okay to the next morning. Or if I talk to somebody and they're saying they have a little problem, I'd rather them come in and see me at that time
Right.
versus needing to address it at 10:30 at night
Yeah.
when it's harder to get
Go ahead and put out
get
that
back
fire.
in there.
Yeah.
So, I enjoy that because then I get just even talking with them.
And that's
Then,
good service.
and it's,
yeah.
but I also get good feedback. If they had an issue with something at the office, I hear about it.
Right.
I would much rather them feel that they can talk to me about that because that's good because there's misunderstandings or just things that are done, but I can always, I can address that.
You're a surgeon, but you're also a business owner, right? So how do you wear both of those hats during the day? Is that hard to do, or is it kind of just something you've, figured out?
I've gotten better at it over time because I think one thing I learned from when I first started out is I used to think that I had to put out every fire at that exact moment whenever things happened.
Right.
Well, I can't do that. And so I've learned I've learned to do a better job of especially when I'm doing surgery. When I'm doing my surgery and my sedations, that's where you have to be focused because it's really only that patient that's important at the time. So I've trained my girls that they're very good about if there's something that they have a question about or a message or whatever, they can, through our electronic medical records, they can send me a message. And then once I get a chance, I can then look at it and answer it. So I used to get stopped all the time. Everybody, which is great because usually all the employees that have stuff that they have to get accomplished before they can leave. Well, some of it has to come through me or have questions they ask for me. So they used to have a bad habit of always just stopping me. But I finally was like, you guys stop me every time. I said, but I lose my train of thought. I don't know where I'm going. I said, because then I have to realize if I'm going in to go and see a patient, I got to go back, review their chart again, review what we're doing.
Yep.
So I said, it's much more efficient if we can do it this way and they can communicate with me that way. I said, because then as soon as I can get back to you, I will.
Okay.
If that.
Yeah, I think so. But what about your, do you have like a morning routine or disciplines that kind of set you up to?
So I get up every morning at 4 and I go for a 3.5 mile walk, which has been great because it just gives me a chance. I kind of walk around our neighborhood. I got a rucksack because after doing walks, so it's like basically a weighted backpack that you can keep on adding weights to. Because I don't like going to the gym. I really should go to the gym. It's just not my deal.
Yeah.
Or not my jam. I just don't like it. I need to
3.5
start
walks,
doing it.
Pretty good.
But I like doing my walks. So I do my weighted backpack and I do my walks and I listen to just different podcasts. Some are business ones. Some are just kind of fun, lighthearted podcasts I find. So I enjoy doing that because that's kind of my little break.
Right.
Also, during those times, you're kind of thinking about the day, like what's going on ahead and things like that.
Compartmentalize it. And
then, you get back, get the kid, make sure kids are somewhat set. Usually my daughter and husband go to the gym. So we're getting back about the same time, make sure my son's up, got his lunch, and get ready and go to work.
What time do you start at the office?
At 8 o'clock. I used to start at 7:30, but now with the kids in school and stuff, I decided to move it back to 8. It's just nice, especially getting up early. Because if I start at 7:30, I got to get up even a half an hour earlier. So
anytime before 4 is
so I'm like, I prefer, So I prefer having so 8 o'clock is when we start now.
Very good. Very good. Anything that you think's important that I haven't asked you in regards to the business of being an oral surgeon?
I think the thing and it's not necessarily isolated to oral surgery, but just dentistry and even medicine in general. So much of the stuff you learn on the fly because we're not taught any of this. Some dentists have gone back to school, and even where I trained, where I did dental school, they had the ability to do an MBA along with your DMD. To be honest, I never thought I'd ever own a practice. That was not my goal ever.
Okay.
I actually wanted to teach. I love teaching, and when I was getting ready to finish residency, that was always my goal. I just wanted to teach at the university, which would have been great. But unfortunately for me, the 2 residents the year ahead of me stayed on at the university, so they didn't have a position. So didn't really have a job for me. So that's why I had to
Mhm.
go out and figure out what I was going to do. So it was never really in the plan. And even when I worked for the other practice, I was
Mhm.
very content there. I never really wanted to be a business owner.
Right.
It was just certain circumstances kind of forced my hand, and I was
Yep.
finally like, well, I got to do it.
Yep. So
So
what are some of the being working for somebody and owning your own business? What are some of the biggest differences?
I love the flexibility of owning my own business.
Okay.
That is something, and I love the fact that I can be involved in things, know what's going on. When I was
Mhm.
working as an associate, I didn't have that same flexibility. Um, I also like the fact, for better or for worse, whatever decision's made, I have to own it. It's
Absolutely.
mine. And even if it's one of my employees who make the decisions, I still have to own it.
Yeah, you
They
hired the
work for
employee.
me. They
Yeah.
are, they, well,
Yeah.
they work for me. And
Yep.
if there's something that's misconstrued, it's still, I have to own it. That's because I'm ultimately the one responsible. It's like it's like
Mhm.
the quarterback position,
Mhm.
They get all the fame and glory when things
Yep.
go up. When it doesn't, now Lamar Jackson's not so
That's
good,
right.
right?
All
I
of a
mean, it's
sudden,
just
right?
exactly. And
Yep.
but that's part of it that isn't necessarily quite that fair. But that's actually okay, because that's just life. Life isn't fair, but I think that's some of the fun, because
Mhm.
you have to always then be continually trying to improve. Because if you don't do that, then
Somebody's catching you.
someone's gonna catch you. That's
That's my
right.
favorite part about it too, is if I fail, it's on me. I
Mhm.
can't blame anybody else. There's something I didn't learn or implement, or I didn't work hard enough, or whatever it is. But when we succeed, we can have pride in what we did. So I can certainly relate to that. Um, so what about like young entrepreneurs out there, maybe even aspiring medical professionals? What would you tell them um, to encourage them or to help them?
To help them, I
Yeah.
think anybody going into what's fine. I love, like, I think I see a lot of patients, especially like teenagers and stuff, because that's when they get their wisdom teeth out. And I
Hmm.
love the field of dentistry for them, especially females. Like, I think it's such a great career choice for women to do. It's not as demanding, maybe, once you're done time wise, as say career in medicine.
Hmm.
Like, I don't get called after hours very much anymore. Now, with my specialty, if I wanted to go and take trauma call and get called after hours all the time, I could do that.
Okay.
But it's nice that I have the ability that I don't necessarily have to worry about doing
Right.
that anymore.
Yep.
So I think it's a great career choice. But the other thing I also tell them, where dentistry is a little still more unique than medicine, is a lot of medicine has been bought up by bigger private equity type things, which that's happening some in dentistry now too. But dentistry still
Mhm.
affords you the ability to own your own practice and to be your own boss. It's
Mm.
intimidating, but for those that want to do that, it's a great way to really just uh, to take a chance on yourself,
Right. Right. To bet on yourself, and
to
you can
bet on
still do
yourself,
that.
because you can do that. And so I think it is great, because in medicine is a little bit harder now, because there's just so many of the groups they're just big groups, and they're now either bought out by
So
hospitals,
just hard to
or,
compete.
well, it's hard. There's not as many private practice
Right.
physicians you're see, where dentistry's done a little bit better job of being able to stay in that private
Interesting.
type
Yeah.
space.
So I've seen a couple in your field, a couple dentists throughout the years that have really kind of like stood out with doing something kind of different. There was a pediatric dentist on the Eastern Shore that when my kids were little, I would take them in there. I'm like, this just feels different. He's really smart with how he's. What are maybe some examples of things like that you have seen, or maybe you've implemented in your business um, to just kind of be different, than the typical office?
I think probably the
Yeah.
thing that patients notice the most is, I call them afterwards.
Hmm.
We'd like our kind of little thing, which is we give patients Dippin' Dots on the way out the
I
door.
remember. I barely remember that.
But we do it for two reasons. Is one, I always tell them, is I do really want them to eat something, because
Right.
when they eat something, then they can start taking some medicine. But
Yeah.
then they also remember that there is a little novelty to it.
Right.
It's a great thing for kids. Like, when they come in, even if they're good for their consult, we'll let them go get some Dippin' Dots before they leave, to help
Mhm.
encourage them to come back.
Yeah.
And whenever they come in to see us,
Yeah.
to be good.
Hannah had to wheel me out. But so you don't have to answer this, but any funny anesthesia stories you can tell?
Oh my gosh. That is always
Those
the
funnies
best
are
part.
so funny.
There's
Yeah.
always funny
Does that keep it
anesthesia
light when
stories. Yeah,
Yeah.
there's always usually, though, the patients, especially because there's no men that work in the office, where we're all
Yeah.
females. They usually, especially like you get patients like
Mhm.
teenagers, young 20s, they love everybody. And
Yeah.
I always think it's funny too, because they usually want to come back and get it done again.
Oh boy.
And I always tell them, I say, can we have this conversation tomorrow?
Yeah.
Let's see if you still want to do
No,
it
you're
again
gonna hate me tomorrow.
Yes.
Yeah, those videos online really crack me up sometimes when those kids start talking.
So it's,
So,
that is fun. I mean,
yeah.
every once in a while, you get somebody who's a little teary-eyed or,
Yeah, starts
but yes.
deepest,
You
darkest secret.
We've had a few, yes,
Yeah.
confess some secrets, and we're kind of like,
We're just
maybe
gonna pretend we didn't
gonna
hear
wait.
that.
Well, so to us, it doesn't matter, but
Yeah.
like, we're just not going to get maybe mom back right quite away. It's just like,
Oh, that's funny.
we'll try to protect you a little bit.
Yeah, well, that's good. Is there any future growth plans, or what are you trying to maybe accomplish in the next 3 years?
Oh, good question.
Hmm.
For the future, well, actually, I'm starting to. I would love to have
Mhm.
another doctor, or even whether it be a joint venture with another doctor, get an associate. I said, first of all, I love to teach. So I'd love to have somebody that would want to come in,
To bring
just
along.
work, and
Yep.
just because I feel like I had the ability to be successful in business because I had great mentors.
Hmm.
I had the first practice I worked for, so I was there 6 years. I learned a ton. I didn't necessarily learn a ton about all the business side, but you just see a lot. I learned a lot. They were great mentors, and we're still colleagues and friends, and that's awesome.
Hmm.
I said I would love to even find if there's even another doctor to work with. When you work by yourself, it does get lonely. It's
Mhm.
nice to have colleagues that you can bounce ideas off and
Right.
run ideas off of. And so a partnership with somebody would be awesome, because I think it's because you can learn from each other's mistakes.
Hmm.
You can grow together.
Yep.
And so I think something like that would be
That's cool.
it
Might
was
be the next step.
would be a good step.
Awesome. Well, thank you so much,
Of course.
Dr.
was great.
Miller, for giving us some of your time, and you really did a great job taking care of me, and I hope the Foley
That's right. Yeah.
community, gets. Hopefully, they don't have to have anything
Yes,
pulled out.
exactly.
but-
I said, hopefully they don't have to see me. But
No,
if they
but-
do.
but if they do,
We're here.
I know they're in good hands. So thank you so much.
Well, thank you. I appreciate
Yes.
that.
Yeah. So thank you for tuning in to the Business Builders podcast. We plan on releasing 2 new podcasts every month, featuring local entrepreneurs, salespeople, and business owners. If you find our content valuable, please like, share, comment, tell us what you think, share your stories, and also subscribe.